My name's Tom Baldwin. I'm Chief Flight Paramedic with Trinity Air Ambulance. I'm a 21-year veteran of EMS on the road here in Broward County. Was one of the original paramedics in the city of Davie until they got their system up and running. My dad was one of the original 6 paramedics in Broward County back in the late 60s, early 70s. And I run my own teaching thing as well, which is where I do the CEU programs mostly from for BLS, ACLS, PALS, and stuff of that nature. Plus I do aircrew education and critical care education for those that are in the EMS side. When we talk about first responders in this field, in this section, we're talking about everyone up to and including the nurses that work in the facilities. And then that's the first portion of getting them, taken care of and addressing their initial life-threatening condition that may be playing at the time. And then on to the detox and then the rehab centers and, the follow-ups to, continue the care. Because this is not something, we can't cure this necessarily as much as we can, recover from it. And that recovery depends a lot on the support all the way from the beginning to the end. The opiate issue has become a very large thing to the point where legislation has been passed, as we've seen during our earlier presentations, but we've also found that even the American Heart Association has gone on top of this one with the latest updates of the 2015 guidelines. 2015 guidelines are pushing, even in our ACLS, that you need to think of early on of an opiate overdose and consider giving Narcan during your code run. So, within 2 rounds of medicines and you're not getting much of a response, they want you to start considering giving Narcan during your resuscitation efforts, which is new to us, but these are part of the 2015 guidelines from American Heart Association. Plus, they're also advocating people such as law enforcement, even security in facilities, and anyone that would have the first response to any type of possible overdose to have the ability, at least with opiates, the ability to save the life by being able to administer Narcan. You'll see that a lot more. I can probably foreseeably see seeing Narcan overdose kits alongside the AEDs in the malls and stuff eventually, depending on how everything works out as they do more research. The Florida Board of Nursing has even recently come on top of this because us as the first responders, as Sean has shown, we're not immune to this any more than anybody else. And we're unique because we're all strong-willed. We have strong personalities. And that's everyone from the first responders that are in the streets as well as the people who work in the facilities that take care of these people. These people rely on us, and we have to stay at our peaks. We also have to watch our coworkers to make sure that they don't need help. Okay? And there's a lot of things that are in legislation that have been there for a while, but now it's even becoming more to the forefront, where the Florida Board of Nursing has added a requirement for nurses that on your recertification, and anyone that would be recertifying in like April 30th of 2018, you'll be the first group that will be required to have 2 CEUs in recognizing impairment in the workplace. So along with your medical errors and all that, this is a new requirement that's been put on by the Florida Board of Nursing, which comes into effect in August of next year. But the first group that will be required to have it will be whoever renews in April 30th of 2018 will be the first group that actually will have to have it in order for the renewal. Since we're a CEU provider approved by the Florida Board of Nursing, we, as many of the other CEU providers, have been prompted by the Board of Nursing to go ahead and develop these programs. And this is actually the first running of this program that we developed in order to meet this new requirement. And it's basically going to go into legislatively what's required from us as well as what's available to any coworker that may be impaired. And that way, we hopefully can keep our, because we all know some very good nurses, doctors, all the medical personnel, firefighters, law enforcement, that are outstanding at their job, but then something happens and they get in this. Well, we can save a lot of them if we get to them soon enough. They don't have to lose their careers, okay? As long as they come to us or we get them help through the programs that are available, they can remain being nurses or doctors or stuff of that nature. Once again, like I said, Trinity Air Ambulance, we're a Florida Board of Nursing approved CEU provider. We're providing this course as part of our continuing programs that we have available. We have no financial involvement in this program itself. Like I said, I've already rehearsed this. This course, for this actually day for that matter, we will be offering 2 CEUs, which will automatically report to the CE broker, so it'll show up on your records right away. Make sure you get this packet and you fill it out, the evaluations. There's 2 in here. One is for the seminar itself, which is 4 CEUs, and there's 1 in there specifically for this subject matter to meet the nursing requirement. Okay, so there is 2 of them in here. Just make sure we get these back at the end of the day. That way you will make sure you get your CEUs. Even though this is not a requirement for EMS, there is also been approved for 2 CEUs for the EMS board, or Bureau of EMS, I should say, under CE broker, under the general CEU categories. So those are definitely approved by their boards. Others may be approved by anyone who's not in those 2 that thinks that their board may approve if we provide them with a certificate for it. Please let me know. Fill out the form that I gave you so we have your license numbers in that. And then we'll issue you a certificate that you can submit to your boards to see what kind of recognition they'll give you for that.
I think there was somebody that was an MT that inquired whether or not we could give them boards. I had them fill out the paperwork for you.
If you're in that category where you're not in nursing, and this is all levels of nursing from LPN all the way up to nurse practitioner or nurse anesthetist, those are approved. They're already board approved for this course. And EMS, already board approved. Everyone else, I can give you a certificate that you can submit to see if it'll be done, and it'll show on there that it's already board approved for these other boards, and that may give a little more weight to them approving it for your discipline. Say again, please? Go ahead and fill, if you're not a nurse, and fill out and put your code in there, your license number itself with the letters and everything. And there's a blank section on the front of them on the bottom right-hand corner. Put your mailing address so we can mail your certificate to you. The objectives of the course is basically it identifies the signs of impairment that are found in the workplace. Let me get this thing away from me every time I touch it. Also, what are the employer initiatives to promote the safety and provide assistance to those who have been found to be impaired in the workplace? And the essential steps and how to make a report or a referral. And also the mandatory reporting law, which is under Florida statutes 464.018, which mandatorily requires us to report if we know that someone's impaired. Treatment programs for impaired practitioners is another section in the Florida state statutes. This program also, though, does have a program which we'll get into very shortly that you can go to beforehand, before it becomes a disciplinary action, before it becomes you've lost your license. If you go to these beforehand, you can actually maintain your certifications. There's a whole program that's been already established in the state of Florida. It doesn't cost anything to go to this program, which I'll talk about. But what it is you would have to pay for going to the treatments and the surveillance portion of the program. And then once they deem you safe to return to your practice, you'll still have your license and still be able to practice in that field. And then there's different impairment treatments that are available, and under this program, they actually get to dictate facilities that are with proven track records. So you're not just going to a detox or a rehab program that doesn't have a track record or shown successful. Now, under the American Medical Association, they actually have a medical ethics option, which states it is unethical for a healthcare professional to practice medicine while under the influence of a controlled substance, okay, alcohol or other chemical agent, which impairs their practice of medicine, anything that's mind-altering. Further to that, the Joint Commission, our friends, JACO, we all very much know them, okay, they have come out with basically the same statement. Okay, so both of the two overseeing agencies are going to be saying the same thing about this. The new rulemaking in reference to requiring this law is the Florida statute 464-013-3, which is a new one requiring this class for recertification. And it's a biannual requirement, which means every other recertification you have to do it. You don't have to do it every one, but if you choose to, you're okay to do that. It's just CEUs for you. But just like the medical errors, or the domestic violence one, it's every other recertification, not every certification. This is, once again, is a it's an every other certification requirement. One of the things is the employers have a responsibility in this whole thing. They have to create that safe environment for the patients as an expectation of them coming to the facilities. And therefore, they have to have in place both operational as well as physical stops to help prevent someone abusing drugs, especially in the facilities themselves. This is one of the things that brought about Pyxis, and we all know how we all love the Pyxis. But part of that reason was to prevent what we're talking about here today, okay? Because most of the drugs that are being abused today are pharmaceuticals that are prescribed, not necessarily what we're used to in the old days. Also, someone who's impaired can lead to injuries, dropping a patient, falling down themselves, medical errors. We all know how serious that is recently in our field, and things of that nature. So this is another reason why the facility has to put these procedures in place to help prevent, the mishandling of narcotics and things of that nature. And also to educate their personnel on those procedures and also what's available to them. We talked about the employee assistance programs and stuff like that. That is one source that is available to someone. There's one more direct, which we'll get into a little bit later, which is more on a state level. But right now, we're talking about what the individual employers are responsible for. They should, provide strategies that are safety for the patient. Everything like some facilities still require that 2 people count the narcotics during shift change. And plus, when you pull a narcotic from the facility or from the Pyxis, you take what you've dispensed for that patient, and then you count what's left in there. That's to make sure that nothing's missing from the count. Always have a policy for the drug-free workplace. Pre-employment drug screening, helps with the initial employees coming in to the programs. And also, there's, if there's a high suspicion that there is someone that may be impaired, is to go ahead and do a spot check. They are required not only to do the initial hiring drug testing, but many of them have to do some sort of random testing. A lot of facilities have chosen to do this by doing what they call event-motivated testing, which means you hurt yourself, you had a needle stick. For the EMS guys, you fell, you dropped the stretcher on something, or you dropped a patient or something, whether it's you or someone else, but it happened during the work. One of the first things they'll do is to do a drug test. It's not saying you did drugs, but it's part of their random drug testing that they're required to do. Also, when it comes to anything, it's transparency of the documentations. Of course, your medical records are guarded. They're not like regular. They're not as guarded as your administrative documents and things of that nature. Also in the workplace, you know how your workers work. You know when something changes in them. If you just started working with them, you may not know their quirks and know their personality very well. But if you've known them for a while and you see a change, communicate with them. Turn around and make sure they're doing okay. Okay? Try to aim them in the right direction. It could have nothing to do with them, with anything with drugs or alcohol or any kind of substance abuse. It could just simply be they're having a bad day. But kind of keep in mind, make sure they're staying to that safety par that you've known them to be at. And if not, and you're highly suspect that they're showing up later and later, they're having more and more errors in their documentation, one of the big ones in the hospitals especially, if you have more and more patients complaining about their pain and the pain medicine, the nurse not bringing it to me, or that happens sometimes even when you're doing it right. We know that too. But if it starts doing, and then what the patients are telling you they're getting is not what's showing up in the Pyxis. That's showing that someone's dispensing from the Pyxis the pain medicine, but it's not getting to the patient. Like the patient's had no pain, but according to the Pyxis, they've been given a pain medicine every 4 hours. That's another way that they're getting access to these pain medicines in the facilities themselves as well. We talked about the employee assistance programs. Probably they're there to help employees maintain their jobs. They have a lot of direct oversight and things to make sure that they're safe to go back to work. Sometimes you get pushbacks from them because people think that the facilities may feel that the program is going to cost them more money if they're doing this, when in actuality, it significantly saves them money from having to retrain someone and put them through the hiring program and do all the other things, when it may be easily addressed with a simple assistance. Well, things like even the one that seems to be overlooked by the general public and a lot of times is alcohol. It's legal, but used when working and you become impaired, it's not legal. Whether you're an EMT, paramedic, doctor, anyone in the medical field, if you're working in the workplace, you cannot be impaired even slightly. And remember, impaired does not mean I'm falling down the steps and I can't walk straight. Okay? A lot of the EAP programs are put there as a place for resources for the employee. Usually there's signs everywhere. And it's not just for substance abuse. There's a lot of things from stress management, marital problems, all those things. The EAP programs usually are supposed to assist with those things. Also, like I said, we work in a high-stress situation, so you have, alcohol. Have anyone worked in a facility where alcohol was actually prescribed? You get nursing homes in that, and the doctor writes, he's allowed to have a beer a day. So, yeah, it does happen. So, there's a potential even for abuse of alcohol in those circumstances. Usually work in high-stress areas, large number of hours worked, which is a big problem for us in the medical field and law enforcement. Got to work those extra hours to, Christmas is coming, right? I kind of went over these already. Many employees may not get involved in EAP for a lot of reasons. One of them is the EAP program is being promoted by the employer, okay? So there's a fear the employer may be getting the information from the EAP programs themselves, when technically you don't even have to tell your employer what you need the assistance program for. You just need to tell them, I need to contact the EAP. And they give you the phone number and you call, and then you can tell them what you need. But when the employee is providing it, sometimes they always tend to think that somehow the information is getting fed to their employee while they're seeing them. And that can affect their promotions and stuff of that nature. And let's see, where to go. There's a lot of things that they're looking at when it comes to need for the EAP. It's not just the substance abuse that we've been talking about all day today. It's also things from mental illness, which can be depression, which our jobs alone sometimes can cause. Common things, there's a survey that can be put out by the EAP and some other programs that can assess what your possible impairment may be or what your needs may be. Some of the ways to recognize some of the signs. About 6 to 8% healthcare professionals abuse drugs. It's a fact. And approximately 14 develop alcohol use disorders because it's the available one and quote unquote legal. And this is compared to those of the general population. But we also see now how alcoholics can get their alcohol without having to actually drink anything. Vaping is, that goes straight to the brain, so that's 10 times worse than having that little stash that people would sneak into the workplace. And alcohol is the most commonly abused substance in our healthcare profession. Once again, because it's legal. And we all are near type A personalities, so we can say that I can control it. We're at higher risk because of the way we work. We've already heard that from many of the speakers today. And like I said, it's our type A personalities that make us think we're in control. And when it comes to these things, we're not. Certain personality traits and aspects, everything from obsessive compulsive personality styles, family history of substance use or disorders, childhood family problems, personal mental illness, denial of personal and social problems. I can never do this word, it kills me every time. Perfectionism. Does anyone know a perfectionist in their job? That's pretty much most of us.
I only saw one hand go up.
Many of us will never admit to it. Idolize them. Oh, I can never. Okay, the willingness of a nurse and the length of the treatment is the strongest predictors of success. Often nurses resist substance abuse treatment and only enter the program under encouragement by the friends, family, peers, management, or court order, preferably by someone that doesn't require a court order. Because that reduces the stress along, which would be more likely to be successful, which is why you as coworkers should be watching for this to try to get them the help as soon as they can possibly get it. Some of the signs to watch, like I was mentioning before, medication documentation errors, poor work quality, which is not their norm. leaving work early and arriving late, difficult meeting deadlines or schedules, excessive use of sick time, unless you know something else is going on with their family, poor charting, many mistakes, absence, from the units when they're expected to be on the floor, mood changes after breaks, you get them and they're a little antsy and stuff, and all of a sudden they come back after the break and they're calm, cool, collective. Rounding at odd times, which means they're rounding when other people, they're not going to come across them, so they're kind of on their own with the way they round. Suspicious attitude towards others. Large number of waste narcotics. Not performing narcotic counts. Frequent reports of patients not getting adequate pain relief, which I mentioned before. Maximal use as needed pain medicines for all patients, which means instead of getting the up to, they get the maximum every time they get pain medicine. So the patient might get the normal suggested initial dose, but they're dispensing the whole thing, and they're giving the patient the minimum dose, and they're keeping whatever else is left. But then charting that the patient got the max dose. Altered orders, unexplained need for money, dishonesty, increased narcotic sign-outs. Some of the requirements for the state statute is, like I said, this is the number. If you want to keep a number for your friends that work in the field, this is the number to remember. Okay, and it's the intervention project for nurses. Okay, it's the IPN. It's a state-run program. You can see the number here for it. This is the Florida state one. This is not a national one. Unfortunately, this is a state of Florida number. This is the one that's going to refer you to approved counselors by the Florida Board of Nursing for anyone that has a suspected addiction problem or abuse problem. It's meant to enhance the public health by improving the safety of our patients in the hospital, where there's an anticipation of having people who are well and able to make good choices.